Sex education in the United States has and still is primarily taught through an abstinence-only curriculum. Despite the fact that the United States has one of the highest rates of teen pregnancy and sexually transmitted infections disproportionately affecting adolescents, it is clear that this abstinence-only curriculum is not working. Thus, sex education should be reformed and mandated across all schools in the United States. The use of abstinence as the main promotion in sex education is not effective, as is shown in 1. Impacts of abstinence on teen sexual behavior and outcomes, hosted by Kaiser Family Foundation on June 1st, 2018. Teens in abstinence-only education programs were no more likely to abstain from sex than teens that were not enrolled in the program. Among those who did have sex, there was no difference in the mean age at first sexual encounter or the number of sexual partners between the two groups. The study also found that the youth that participated in these programs were no more likely to engage in unprotected sex than youth who did not participate. While teens who participated in these programs could identify types of STIs at slightly higher rates than those who did not, program youth were less likely to correctly report that condoms are effective at preventing STIs. A more recent review also suggests that these programs are ineffective at delaying sexual initiation and influencing other sexual activity. Studies conducted in individual states found similar results. One study found that states with policies that require sex education to stress abstinence have higher rates of teen pregnancy and births, even after accounting for other factors such as socioeconomic status, education, and race. Some may ask themselves, why is teen pregnancy and the disproportionate rate at which adolescents are contracting sexually transmitted diseases an issue? This source explains why. 2. Social and economic costs of teen pregnancy, posted by National Conference of State Legislators on April 1, 2020. Certain social and economic costs can result from teen pregnancy. Teen mothers are less likely to finish high school and are more likely than their peers to live in poverty, depend on public assistance, and be in poor health. Their children are more likely to suffer health and cognitive disadvantages, come in contact with the child welfare and correctional systems, live in poverty, drop out of high school, and become teen parents themselves. These costs add up. According to the National Campaign to Prevent Teen and Unplanned Pregnancy, which estimates that teen childbearing costs taxpayers at least $9.4 billion annually. Brittany Bass from University of California, Irvine also writes on November 27, 2016 for Esprit Working Paper Series, sexually transmitted diseases, STDs, are a severe public health problem in the United States. STDs are harmful, often irreversible, and costly complications, especially among females. There are approximately 20 million new STD infections each year. Nearly half of these infections are among young people ages 15 to 24 who present only 25% of the sexual activity population. The estimated cost to the U.S. healthcare system from these new infections is $16 billion annually, including HIV and HPV diagnosis. Among the non-viral STDs, chlamydia is the most common and costly infection, estimated at almost $517 million in annual healthcare costs. As we can see, an abstinence-only sex education in the United States is not working. The main way we can combat the high rate of teen pregnancy and the disproportionate rate at which adolescents contract sexually transmitted infections is by reforming sex education and mandating it across all schools in the United States. This source explains why this change will work. 3. Comprehensive sex education, posted by the American College of Obstetricians and Gynecologists on November 2016. Studies have demonstrated that comprehensive sexuality education programs reduce the rates of sexual activity, sexual risks, sexually transmitted infections, and adolescent pregnancy. One key component of an effective program is encouraging community-centered efforts. In addition to counseling and service production to individual adolescent patients, obstetrician gynecologists can serve parents and communities by supporting and assisting sexuality education. Because of their knowledge, experience, and awareness of a community's unique challenges, obstetrician gynecologists can be an important resource for sexuality education programs.